So it looks like we are streaming live on Facebook. Hello, everybody. Welcome on this beautiful Monday morning. We are so excited. I'm very excited about today, and I'll tell you guys about that in a second. So just so that you know, for some housekeeping notes, this webinar is going to be about 45 minutes to an hour long. And if at any point you have any questions, you're welcome to put them into the live chat box. We are running live on both Zoom and Facebook Live, so we'll be fielding questions from both. But yes, let's get started. So I am excited because for anyone who doesn't know who I am, my name is Amanda and I'm the CEO of SocialMama App. SocialMama is an app that's available for free on Google Play and the App Store, and it is an app to find mom friends that you need and the experts that you can trust for advice. And Dr. Aimee is one of our experts on the app. But the reason why I'm so excited is I am a personal fan of Dr. Aimee. She's been coined as the Egg Whisperer. She's developed a 3-step plan for fertility testing, consultation, and tracking. She completed her residency in gynecology, obstetrics at Harvard Medical School, which is so cool because I'm a Bostonian, although I live in Texas now, so I love a Harvard girl. But what's exciting about what she's done is she makes things easy and simple to understand. And when I started SocialMama, a lot of the topics weren't a struggle for me personally, but fertility was. I didn't realize until I started running a mom company that I knew nothing about my own fertility. And how are all of us as women walking around confused about fertility, which is something we should learn probably in elementary school. So we're super excited. She's helped thousands of women get their bundles of joy that they're looking for and understanding their fertility path. So let's get started. Dr. Aimee, how are you today?
Hi, Amanda. Thank you for having me on. I'm so excited to be talking to everyone about something that I'm so passionate about. I mean, literally, I get to do what I love every single day of the week. And I literally do it every single day of the week on Saturdays and Sundays. And patients sometimes ask me, like, how are you still here on a Saturday? Like, are you sure you want to come in for me? And I'm like, listen, I am so fortunate and lucky that I get to do what I love. So to be able to get to do it even on a Saturday for me is like game on. Let's crush it. Let's see what we can do to help you have a baby. And I'm so excited to talk to everyone here today about something that's near and dear to my heart. And that's how to prevent infertility, how to check your fertility, how to improve it, how to preserve it, and how to have the healthiest pregnancy possible.
I love it. I love it. And I think that's what's so great about Dr. Aimee is she really is available all the time. If you don't, of course you can find her on the app. So I don't normally say this, but you really should follow her Instagram page and her YouTube. She's on literally at 10 p.m. doing Instagram lives. The times are all over the place because she does, I think, work more than probably anybody else I know. But it's really a great place to get tips, and she's always willing to field questions. So while we wait for some of the questions to come in, and I'm also going to turn on the Facebook so I can see the questions myself, I thought we would just start about just in general, like what is the Tushy method and how did you come up with this?
Yeah, so basically it takes egg, sperm, and a uterus to have a baby. I mean, I know it's a little bit more complicated than that, but life is complicated enough. Getting your fertility checked shouldn't be. And there are 5 things that you can check to figure out what's going on with your fertility. And if someone's given you an answer of your fertility issues are unexplained, what you have to do is realize is they may not have explained it enough. So sometimes I have people say things like, oh, I have unexplained infertility, the sperm is low, they said it's enough though. And I'm like, huh? That's the explanation. And we don't want to sugarcoat these things. We want to talk about it as if they're a disease, just like your heart. You know, when your heart has a clogged artery, you don't just say, it's just kind of clogged, but it's gonna be fine. And I don't know why we do that with fertility. So obviously with fertility comes all this other stuff, like how we were raised and thought to believe about fertility, our culture, our religion. And certainly that plays a role in this because when you're so hopeful for something, what do? You pray for it, right? So I totally get it. But certainly we pray for health and healing with all sorts of other diseases as well. So the Tushy method, like I said, 5 things. T stands for your fallopian tubes. So for your fallopian tubes, that sounds like a funny little rhyme that I just made up, but it's not, are connected to the sidewalls of the uterus. They're not related to your ovulation. You would have no signs or symptoms if they're blocked unless you did a test called a hysterosalpingogram. So this is an X-ray test that allows us to see if fluid is coming out the tubes, and if fluid isn't coming out of one or both, then you have an issue. And the issue is an embryo transport issue. So the egg and sperm, for those of you guys who don't know, meet in the fallopian tube. That embryo travels down the fallopian tube for about 5 days until it lands in the uterus. And I do this because I say these are the tubes, floats down the tube into the uterus. So if your fallopian tubes are blocked, that can't happen. And so IVF is the treatment for that. Then there's uterus. Again, we go into the gynecologist for what? For pap smears. Those pap smear appointments, no one can tell if you have a fibroid right in the middle of your uterus. There's no test for that other than an ultrasound. Your doctor, when they do that pelvic exam, there's no camera at the end of my fingers. I can't see in your uterus, but my wand, some people call it Wanda, but my pelvic ultrasound is such an important tool for me. And I want everyone to think about getting a pelvic ultrasound before you have a pregnancy, especially nowadays. People are waiting longer to have kids, and we don't have time to waste. We don't have time to waste to have a miscarriage and then find out, man, there was a fibroid sitting right in the middle of my uterus. Then we have the S. S in Tushy is sperm. I thought someone's laughing. I'm pretty funny.
I can see that.
Even on a Monday, I'm funny. You guys should see me on a Friday.
Okay.
So the S is sperm, and that's for the sperm, the swimmers. And so there's a test. Now with COVID, no one wants to go into a clinic. Trust me. No one wants to, no guy wants to go collect and produce a sample somewhere strange, especially with what's going on. But there's a company, it's Meet Fellow, MEET fellow.com. You can use the code Egg Whisperer or DRAIMEE to order a kit online. They'll deliver it to your home. Your guy will produce a sample, ship it back. You'll get results within 2 days, right? Like, amazing. So much has changed for us. There's so many DIY, do-it-yourself things that you can do to get your fertility checked without worrying that a doctor is going to say, oh, you need to try for another 6 months. Oh, you need to try for a year. I'm sure his sperm is fine. Trust me, every fertility doctor that's a woman that's married to a man or partnered with a man, we've all checked his sperm before we even got married. Like, that's how important this stuff is. And so if I'm doing it for myself, I want you to know what you can do for yourself. And then there's the H, those are the hormones. And I do a preconception panel, including things like checking your thyroid and your prolactin and your vitamin D, making sure you're immune to German measles and chicken pox, knowing your blood type, right? You don't want to find out you're anemic before you get pregnant. You want to find out these things up front. And then certainly the egg count tests, FSH, estradiol, and AMH. These are 3 hormones that tell us more about your egg quality, when you're going to go into menopause, how you should plan your future family, whether you should consider egg freezing, embryo freezing, or both. So those are really important tests to me, and I feel like women should get their levels checked. If you're on birth control pills, if you have an IUD, because certainly those things can trick you. At your postpartum visit, you should get your levels checked, kind of understand what's going on, so you don't sit there and wait 3 to 6 years to like get used to your new family, then to find out that your eggs have really, declined in count, which is totally normal. But unfortunately, there are so many myths out there where people are told things like, oh, just get pregnant with your first baby and the second one will be easy. That's a big fat fertility myth. And certainly I want it to happen for everyone. But the truth is it may not. And then the why, are you guys tired of me yet? I'm not. No. So we have the why of Tushy method is your genetics. Right? So you're like, what does that mean? Well, carrier screen. Carrier screen is a test for over 100 diseases. Every single company has their own panel of genes. The company that I use right now has about 300 genes on their panel. And I want to make sure the egg source and the sperm source are genetically compatible. You might be compatible with your partner. Well, I hope you are. Because trust me, it does not get better after you have a baby. And then aside for the carrier screen, is the chromosome analysis. So I strongly advocate for looking at chromosomes as well, especially for anyone who's had at least 1 miscarriage. Don't wait. Get your chromosomes checked to make sure you don't have a structural rearrangement like a translocation present that you've inherited from mom or dad, or just a spontaneous thing when you were born. So those are the things I teach people about. This is what I talk about all day long. This is what I educate about. And it's easy stuff. Your OBGYN can do it. These are the simple steps. You can do it just in 1 menstrual cycle. Period starts, day 3 labs, ultrasound, HSG cycle day 8 through 10, get your carrier screen done. You get all the results back within 3 weeks. You make a plan by your next period and you have some answers, more answers and information than you've ever had before.
But that's what's so amazing is that you're giving the tools to help women help themselves throughout the process, and not responding with, which I hear so often from women on the app is, well, I've had 2 miscarriages. They told me to try for 6 more months and then we'll do this for 6 months. And I'm like, but you're already 34. Like you don't have 17 years to plan this, and needles.
Right.
And and it's just
Right.
crazy.
Yeah. And I think that people who have miscarriages don't think that they have, I mean, unfortunately, sometimes the messaging that they're getting from their providers, just keep trying, you know,
Yeah.
and that's just so hard, especially if you're 34 and have had 2 miscarriages. So I actually, believe it or not, I know you can believe it, I have another method. It's called the angel method or angel approach for people like that. It's just to look at your age, autoimmune disorders, look at your nutrition, look at your genetics, look at endocrine disorders, and look at your lifestyle. So that's the angel method for women who've gone through miscarriages, and certainly the Tushy method and the angel method can definitely help women who've had that, so you can get answers and not wait for more losses to figure out what you can do that's in your control to decrease your risk of a miscarriage.
Yeah, because that is really what I've learned from you, is that a lot of it is in your control. The
Right.
ability for you to get pregnant normally with no, with no assistance is not in your control, but there's so many things we can do to help ourselves. So
Yeah.
before we break down some of the stuff which you said, which by the way, for anyone who's listening, don't worry, we are going to break down a lot of what she said as we move throughout the next 60 minutes. But so obviously you can't be all of our doctors. You're in California, although I'm sure that you do online consultations and things like that, which I did put her website on the Zoom, and we will add it in the chat box of the Facebook as well, just so you guys can find her if you need her specifically after, of course. And I do, again, recommend watching especially her YouTube channel. But what do we bring to our own OB? So like, we'll take me for an example. I got pregnant accidentally, very easy the first time. Then I
I hate
decided,
you, and everyone else does too, just so you know.
but yeah, totally accident. And then I went and built this mom company and have not had a second child. And now I'm over 35. So what should I bring with me when I go to my OB's first appointment, when like, I just want to get pregnant? Do I just print out the Tushy method from your website?
Totally. Yeah. So, right. So I talk about the Tushy binder. So literally, so I have a school, it's called the Egg Whisperer School. And my first Tushy class is today at 4 p.m. Pacific Standard Time for anyone who wants to join. But you can join the class and get access to all the materials are in there, and including the materials are things that you can print out and take to your OB. And then I recommend having a fertility binder, and each thing, each, the T, the U, the S, the H, the Y, you can print it out and put it in a binder. And then make sure you've done all the tests and review them with your doctor. And so these tests, like I said, they are things that your OBGYN knows about. They order them, but sometimes they pick and choose just based on like how a patient, their history, or like what they feel the patient can afford. I mean, I think sometimes people think that patients don't want to pay for tests if their insurance won't cover it, but these tests are pretty like, cost effective if you think of the cost of like going through a miscarriage, right? I mean, like checking a thyroid test and then fixing it is a lot cheaper than waiting to find out that might have been the reason for a potential miscarriage. So that's what I would do. I mean, if you're over the age of 34, for example, struggling to have a second baby, you can order the sperm test right now because your partner is older as well. I strongly recommend for everybody in that relationship, I mean, not everyone, not your neighbors and your friends, to take CoQ10, although they probably should. I strongly advocate every young woman, or every woman, I think of everyone as young, by the way, to take CoQ10 until they're done with their kids, because it can potentially lengthen the lifespan of your eggs, potentially. That's what has been noted in the animal model. And of course, we're not all mice running around, but in mice, hopefully it would work out for us too. So if you are someone who's not done with your kids, do that. But I would say just get your levels checked as a starting point. And your doctor probably already knows that you don't have a fibroid in your uterus because, you had a baby with them recently. So you don't necessarily have to feel like you need to rush in to do that. But I would say if you have a history of a fibroid, maybe, do a quick ultrasound in the office, do some hormones, check the sperm, and then, maybe do a tube test, and then talk about, what does this information tell me? What's my diagnosis? What's my prognosis? And what's the treatment that you recommend for the family size goals that I have for myself? And you don't want to take your youth for granted. My patients who are 40, they wish they had these kinds of panel discussions that they could have been a part of so they can learn from. Because 100% of my patients over 40 wish they had frozen their eggs at 36. They wish someone had told them, like, you should have been proactive, or you should have learned about your fertility. And I think OBGYNs are doing a great job now recommending these kinds of tests to their patients. So when you go to your OB, they're not going to roll their eyes and be like, oh, honey, you're too young and pretty. You don't need to worry about that. But certainly like 6 years ago, I was hearing that all the time. So that's why I said I need to start my YouTube show so that can stop happening. And then eggwhisper.com for people who want to get their levels checked and have an OBGYN that's rolling their eyes.
But I love when other doctors make other doctors roll their eyes. One of the things we talk about all the time, not typically at our fertility, but I will say this as a disclaimer too. It comes up a lot in our pregnancy and our birth classes that we do. If you are not comfortable and happy with your provider of any kind, it's time to get a new provider, ladies. Too many of the moms on our app stay with doctors that they're not comfortable with, that they don't think that they're good at their jobs. What are you doing? There's amazing doctors, so find somebody that you're comfortable with. That's probably step one.
Right. And the thing is that OBGYNs are really wonderful people. They're really patient and really kind and empathetic and compassionate, but they aren't necessarily trained on all the fertility stuff. I mean, I went to baby making school for a heck of a long time, right? I had to train after OBGYN school for 3 more years to figure out that an egg and sperm make a baby. And, you know, OBGYNs, they get maybe a few weeks of training. I mean, and it's really not hands-on the way like maybe it used to be a long time ago, but now there's so many tools, so many more tools that we have in our toolbox. So your OB just may not be comfortable analyzing the results for you. And if that's the case, you don't need a referral to a fertility doctor. You can go right in and get a fertility consultation. And now with COVID, all of us are doing video calls for people, and almost everyone is doing these types of initial fertility counseling sessions for people who just want to learn a little bit more about their fertility. And then we're welcoming people. And just because you're coming to see us to just talk to us to learn about your body doesn't mean we want to sign. Like for me, like I don't want to freeze everyone's eggs. Trust me. I don't want to do IVF on everybody. Trust me. I want people not to need me. So I'm hoping that by learning this stuff soon enough and learning what you can do to advocate for yourself and ask the right questions, less people will need me.
Yeah, that's actually been a nice silver lining to COVID, I have to say, is some of the experts that were on our app pre-COVID really weren't familiar with online consultations. They weren't using software for it. And now almost all the physicians have it set up because it was a necessity during COVID. So that's what's super cool too, is if Dr. Aimee is the doctor that you want or a different doctor that's not in your hometown, there's no reason why you shouldn't reach out and try to set up an online consultation. It makes a huge difference. So we have one question that came through so far. And I do have a bunch of questions that I pulled off of the app off of the last week that were questions around fertility. So somebody said, my thyroid level is within medical normal, but was prescribed Synthroid, took for maybe 3 months, but didn't seem to help. How long do we take that type of meds to know if we need to keep taking or stop?
Just, you know, tracking and trending your levels is really helpful. So looking at your TSH, free T3 and free T4. And so if you're taking it and your levels are at the level that your doctor is aiming for and isn't dropping or rising and you're stabilizing, then you just keep taking it unless you're getting severe side effects from it. But treating a thyroid problem, and if you're still not getting pregnant, then realize that there are other things that could potentially be involved. But a healthy thyroid is extremely important when trying to get pregnant, and especially in the first trimester and also postpartum as well.
Yeah. So that actually brings us to another question that we were asked earlier, which is great, which is also about medications. And is there any medications that myself or my husband could be taking that could be causing infertility?
Absolutely. So for men, for example, especially in California, everyone like looks like The Rock, right? They're all like toned, like getting ready to, you know, that show, The Titan Show. My husband loves that show, by the way. I have to watch it every single night, every night, like literally.
My husband's obsessed as well.
Yeah. So like a lot of those guys that are like that, testosterone shots are not uncommon, and that's a birth control pill for men. And there's no amount of testosterone that's good for sperm. So it might be good for your muscles, but it's not good for your swimmers, because your swimmers get this signal that they don't need to do any work anymore because they're getting all this testosterone inputs. They go on vacation. So that's one medication that guys can take. Another medication is called a calcium channel blocker, and that's commonly used to treat high blood pressure, and it blocks fertilization. The good news is that the effects are reversible, and the sperm life cycle is 2.5 months. So even if you're doing IVF in the IVF lab, it could potentially inhibit fertilization as well. So that's a big no too. The other thing is diabetes, not diabetes drugs, but diabetes that's untreated in general. So if your partner is diabetic, it is so important to make sure his diabetes is controlled. You know, just being on medications isn't enough. You know, you could be on medications and have a hemoglobin A1C of like 9 or 11. And so I tell those patients of mine to march right into that doctor's office and say, treat my diabetes. I need my diabetes treated. I need that A1C nice and low, because having high blood sugar can decrease egg quality and sperm quality, and therefore embryo quality, and we want the healthiest pregnancy as possible. So those are just a couple things, but I would definitely run through your medication list with your OBGYN or a fertility doctor to see if there's anything you'd need to do ahead of time. And then certainly there are some medications potentially women can take, like spironolactone, for example, is a drug that we take sometimes for our acne. I'm on it. It's doing a pretty good job, except for this little crater that I have covered with my hair right here. But anyways, I don't take enough of it apparently. But that's one medication that if you're taking can affect things and cause potentially birth defects. So we like women to stop it before they try and get pregnant. I mean, most of us know this kind of stuff, but again, like I don't ever want to assume that people know that. And then one thing to be sure to take is folic acid, prenatal vitamins. I mean, a lot of us are so lucky to have access to fresh fruits and vegetables and green leafy vegetables that have lots of folic acid in there, but if not, just so important to take an extra folic acid supplement in a prenatal or a multivitamin before pregnancy.
Okay, so from what you're saying, and I know I've heard this before in some of our other webinars, is that nutrition does contribute to fertility, correct?
Oh, for sure. I mean, if we're eating foods that are highly processed and fried, I mean, that affects our blood sugar levels. That affects everything. That affects our hormones. And that can interfere with healthy pregnancy and can lead to other complications in pregnancy, especially if it causes your body size to be over a certain size. And that can cause blood pressure issues and all those kinds of things.
Yeah. Well, and you know what, one thing that we did a diet seminar last week, one of the things that we were talking about was every morning, just starting your day with a ton of spinach or kale, a frozen banana, and some water in a smoothie. I'm telling you guys, it really does taste good. You don't taste the kale, and it starts off your morning just with, it's just hypernutrition. It's amazing. So
I think you're lying. How do you not taste that? That sounds disgusting.
I'm telling you,
she's lying.
So I was very sick when I was in my early 20s and ended up having a really bad pregnancy because of it and some other things. I have pseudotumor cerebri, which I talk about publicly all the time, actually, with SocialMama. And I started when I was 21. And when I tell you it is a ridiculous amount of kale, a frozen banana, and then I also put a huge handful of frozen pineapple in water. I am telling you, it tastes like banana and pineapple. You do not taste the kale. It's amazing.
I mean, I love kale. I'm teasing. I think it actually sounds quite delicious. I would totally be on.
But I feel like I'm always pitching to women because I think that we psych a lot. Like we're just taught growing up, most of us, certainly in the mainstream American culture, that like green equals disgusting. And it really doesn't. When I was 21, it was like this transformation of relearning how to eat. And luckily I had just met my husband at the time. Of course, he wasn't my husband then. I was 21. And he grew up in a vegetarian household. So he was like, why do you think vegetables equal gross? And I was like, I grew up with steak and potatoes. It was a really big learning for me. But anyway, so, okay. So we have one more medicine question and then we have some other questions, but they're not medicine related yet. So one of the questions was, I'm a recreational pot smoker. Does that lower my chance of getting pregnant? I'm also 30. Yeah,
it does. And it also increases your risk of miscarriage. So cut it out.
Okay.
Simple as that.
Perfect. Okay, that one came from the app. So none of the other ones are medicine. Okay, so we have another one here that is, hopefully I don't butcher it. I'm 34 and have low AMH, 0.67. Hubby has low sperm, under 8M. So we did IVF. Finally, we were able to freeze some embryos and just had our first baby in April. Having gone through this process for nearly 4 years and being given the runaround that you mentioned, we really want to start thinking about number 2. Do you have any advice or recommendations?
Freeze embryos right away. Get all your levels checked again, start supplements, and then see if this is a good time in your life. I would definitely do it. I wouldn't wait. So congratulations on your baby in April, but this is a great time to freeze more embryos. That's what I would say. You don't need to transfer them fresh, but by freezing them, you're preserving options for your future. And I think that would be a great idea.
So how does freezing eggs work? Since we're talking about that, because that was another question that was on the app 2 days ago.
Totally. So freezing eggs is just like IVF without the F. Okay, so the F is the fertilization part. So a woman who's going through egg freezing is doing the exact same thing that a woman who is going through IVF is doing. She's seeing me a whole bunch of times. And you would think people get sick of me, and they probably do, but they just don't tell me. So from start to finish, an egg freezing cycle is literally around your menstrual cycle, and it's 5 visits. The first visit around when your period starts, and then there's 3 more visits, and those visits are all done to watch the follicles grow. So we watch these teeny tiny little follicles that are fluid-filled sacs that contain an egg in each one. Once they go from like 8 millimeters and they grow to about 20 millimeters, then we know the egg inside is ready to be removed. That 5th visit approximately is the egg retrieval. And that's a procedure in the operating room, and it's a pelvic ultrasound while you're asleep. So you have an IV place, the anesthesiologist gives you some special secret sauce to put you to sleep just long enough so that I can do my procedure and you wake up feeling like it never started. So many women, when I do it, they're like, have you started yet? So that day you're usually a little crampy, your ovaries are a little swollen, and then your body recovers by the time your period starts around 10 days later. During that 2-week period of time, when you're coming in for those 5 visits, you're taking fertility shots. So these are hormones to grow the eggs. When I say shots, people all of a sudden shudder and they want to run away from me. I don't blame you, but the needles are really small. They're 1/2-inch needles in the skin of your tummy. And, you know, I am obviously biased, but I think for a woman who could benefit from egg freezing or embryo freezing, I think it's worth it. I think the only thing that women sometimes regret is not doing enough to preserve her fertility or learn about her options. But I rarely had someone who wished they hadn't frozen their eggs.
Yeah. Well, I think especially nowadays, because so many of us, which is so amazing,
Yeah.
so many of us though are in 2-career households, or we're choosing to have babies on our own if we don't find our significant other by the age of 40. And I really think that it is very empowering for women to freeze their eggs, and it's very empowering to own your fertility. It's like owning your own sexual health.
Right.
It's important that we understand how sex works and how fertility works. So
Right.
I think it's a great idea.
Yeah, and for women who are unfortunately in relationships that you feel like may not last, I strongly recommend freezing your eggs, even if you're married, because you don't need his permission to do it. And you're not stuck with him. It's not a lifetime of parole, without parole. If you have kids with someone that, you know, I always tell women, listen, you don't need the guy, right, to have the kid. You can do it on your own. You can choose the love of a child over the love of a man. And if a man or your partner is meant to be, it'll be. But your eggs aren't going to wait for that guy. Trust me, they just won't.
They're definitely not. I have a 3-year-old, and his best friend, that's what his mom did. And let me tell you, they're the coolest family. Like, and they have this special relationship. It's amazing. And she froze her eggs before she was 40 and ended up doing it. I think she was 46 when she carried the baby at 46. It's amazing.
Yeah.
And now she's over 50 and she's looking now, I believe, for a surrogate so that she can have a second child all on her own, which is just so incredible that you can do
my
that.
kind of mom. She's a social mama. She's awesome.
She is. She's amazing. So, okay. So we have a follow-up question to the pot smoking question, which is different mom. So obviously it's a very hot topic right now. Yeah. So is recreational pot smoking bad for my husband's sperm?
Without a doubt, it increases DNA fragmentation. It changes your husband's hormone profile, so it can decrease testosterone levels as well. There's no amount of safe pot for sperm also. And there was a beautiful study published out of Boston University showing women who didn't smoke pot, but who had partners who did, had a much higher risk of miscarriage. So what that means is that marijuana is doing something to the sperm quality that's not good. So he needs to cut it out as well. As soon as you're pregnant, he can do it somewhere else, so you're not exposed to secondhand smoke if it's not an edible. But for the most part, almost always, I strongly suggest both the person with the egg and the person with the sperm, no marijuana. And CBD, same thing. CBD can bind to certain receptors in the lining of the uterus and the fallopian tube that might impair tubal motility, meaning how the fallopian tube moves, and implantation inside the uterus. So I also talk about CBD use with my patients as well.
Which is interesting because, I mean, I feel like so many people now, with it being legal in general for recreation in a lot of states, but also CBD it's everywhere, even in Texas. And we don't, in general, Texas doesn't, go blew that often. So, but we have CBD shops everywhere now. Right. So, okay. So then also a simple medication-ish related question. So is caffeine bad for fertility? What about like 2 or 3 cups a day?
Caffeine isn't bad. I say limit it to about 2, 2 to 3 if it's a weaker cup of coffee. It's safe for patients who are trying to conceive, and it's also safe in pregnancy. But I only tell women in pregnancy to just be careful, because in pregnancy, your heart rate automatically goes up. That's just the normal maternal physiology of what happens to our heart. And that can be something that's kind of annoying when you're trying to go to sleep. So even a tiny little bit of coffee can cause insomnia. So sometimes even a decaf cup in pregnancy can feel like a full caffeinated cup. So also in pregnancy, you can feel super tired, especially in the first trimester. So having 1 to 2 cups isn't going to hurt a thing. So 150 milligrams, some people say even 300 milligrams is safe in pregnancy as well.
That's amazing. I feel like I'm constantly telling pregnant women on the app it's okay to have half a cup of coffee. Your heart will
It
race.
is.
You will feel it, ladies, possibly.
No. And I have patients that email me, I was so bad this morning, I had coffee. I'm like, huh?
Yeah. No, it is a constant it's a constant debate, but you know what's so interesting about motherhood in general versus everything else that you go through as a female? Because it's something that people can see. They're so willing to give you opinions, like people in the
Mhm.
grocery store, people on the street. And a lot of them are these old wives' tales.
Right.
I mean, that are completely illogical now, but and I think that the coffee is an example of something that's a little bit of an old wives' tale at this point that's
Mhm.
stuck deep into our society. So, okay, so let's go on to another question that's completely unrelated. So, what can I do on my own, health habit wise, is that could increase my fertility to give me a greater chance in having a baby?
Yeah, for sure. So take supplements, take CoQ10, exercise most days of the week, have a plant-based diet with your animal protein not coming from red meat, sleeping well 7 to 9 hours per night, alcohol in moderation. If you have a hard time doing that, stop completely and look at your body mass index and make sure that it's in the healthy range. So all of those things are in your control and things that you can do, aside from the things that I talked about, like getting your Tushy checked, because certainly there are things that you can't control or know without getting certain tests done, like there's a fibroid in the middle of your uterus. There's no amount of exercise that's going to fix that. So those are the kinds of things that I recommend from a lifestyle standpoint that can help you get pregnant and have a healthy pregnancy.
Yeah, I think those are definitely important. So, okay, let's move a little bit more. So we've talked a lot about what can you do to find out about fertility. Let's talk a little bit more for the women who are already struggling with the fertility issues. When do we know it's the right time to start looking for IVF?
So diagnosis before treatment, find out what your diagnosis is, okay? And then the thing is this, that people who need IVF to get pregnant are people who have 1 or 2 blocked fallopian tubes, sperm count is really, really low, or you share a common gene mutation with your partner, for example, a gene like cystic fibrosis, then IVF is probably the best step for you. However, for other people, you might benefit from IVF if, for example, you're over the age of 32 and you want 2 kids and you've already been trying for a year, then freezing embryos is a benefit of IVF. And you can then have 1 baby now. And hopefully you don't need me or your IVF doctor for the second baby. But most of the time, if you had to go through IVF for the first, that is a myth that if you get pregnant with the first baby, the second one will be easy. So you might want to just have those embryos frozen and do IVF. So that it's a personal thing. Like you can jump right to IVF, like right when you're married, just to preserve embryos. Like you don't need permission to, you don't need to go through 3 to 6 IUI cycles first, or take Clomid or a fertility pill for a year first. You can find out what your fertility issues are and treat it. And if IVF is the treatment, you don't need to waste time with other treatments ahead of time.
Yeah. So I have a question for you actually that I've always wondered. How often does IVF work? What are the success rates with IVF?
So if you look at all comers in the entire country, only about 30% of cycles among everybody who shows up for an IVF cycle will result in a live birth. So that means a lot of people are going through treatments that don't work. And it's related to age, it's related to the genetics of the embryo. So there's certain things that I talk about, and I have something called the Egg Whisperer diet. So D is figuring out your diagnosis first, and then planning your IVF cycle based on your diagnosis, and then doing endometrial testing or embryo transfer preparation before the transfer. And the way I plan my IVF cycles is a 3-step approach. Step 1 is embryo creation. And I always talk to my patients about genetic testing of the embryos and if it's for them to find out if the embryo has normal chromosomes or not. And then step 2 is embryo transfer preparation. And we talk through, should we do extra tests like the ERA test or not? And then step 3 is doing the embryo transfer. And right now the discussions are all about when is a good time to do a transfer. With COVID, I talk to my patients about whether they can stay home, whether they have to go to work, what is their work like, are they a frontline worker? So these are all important discussions for you guys to have with your doctor as well.
So that's been something that people have been chatting about a lot, and it's actually part of the reason why we brought on the expert program to the app, which by the way is going nowhere. If any of you are on our app, the expert program is staying post-COVID. It was started because of COVID, but it's staying now. What have you noticed that's been changing in the fertility world since COVID hit?
More and more patients seeking help. I'd probably say maybe a 15 to 20% spike in patients asking for fertility testing, freezing eggs, freezing embryos. And I know that it's not just related to where I am in the country. I think people are doing that across the country. You know, in March, everything kind of shut down for a little period of time, and I think everyone heard about it. And I think there is a fear that maybe that will happen again. We have a surge in cases here in California, and we have figured out how to take care of fertility patients during this pandemic with COVID testing and certain PPE precautions that we take in the clinic and how we bring patients into the office, stuff like that. And I think if, let's say, there's another surge in November, for example, you know, maybe clinics will shut down. I don't think that they will, but I think people have that fear that they won't be allowed to freeze embryos or eggs. So I think we're seeing a surge in patients coming in out of that fear that potentially they won't be able to get pregnant for 2 years. And a lot of patients want to wait for a vaccine, and I can understand that. They want to make sure that there's no COVID risk. Their partners can be with them at the delivery. You know, that's really sad to have these huge, momentous milestones in our lives, and we have to celebrate those alone. I mean, that's kind of like that's kind of a buzzkill.
It's a super buzzkill. The good thing is we've definitely noticed that March and April were pretty crazy with support people, but now it seems like most treatments and most births are now allowing one support person.
Mm-hmm.
The other thing that we've been seeing a lot on the app, which I never thought about until you see it, was during COVID, a lot of the single moms that had multiple children, when they give birth, they just bring all their kids with them, because what else are you going to do if you don't have a support person, if you're a single mom? So, we have some really great doulas that are now allowed to come in and support people. You can bring friends. So for anyone who's listening to this that is pregnant and maybe joined because of that, there is other ways you can do it if you don't have a partner who's with you. Okay, so we have a couple more questions. Okay, one is related to IVF. I'm 39 with low AMH and have an average 24-day cycle. Am I too late to have a baby or even entertain the idea of IVF?
So what I would say is if your FSH level is, for example, over 13 on day 3 and your AMH is, let's say, 0.3 or below, you're looking at getting maybe 1 to 3 eggs from a batch. Each egg would have about a 10% chance of pregnancy. For me, 10% is worth it. Of course, I'm biased, but you know, I don't want you to look back and you're a very young person at 39. I wouldn't want you to look back when you're like 42 and say, like, I wonder what would have happened if I tried. So financially speaking, trying isn't going to dig into your 401k or anything like that. I would go for it. However, if you have a set amount of money and you really want a baby, you know, I feel like everyone can have a baby. I mean, I don't want to like to make that generalization, but there's so many different paths to parenthood now. Like if financially there's just one amount of money that you have, you might want to set it aside for, let's say, using an egg donor or embryo donor. That, as an example, is basically the same price of going through IVF for yourself, with an 85% chance on average chance for pregnancy. And certainly talk to your doctor about what the chances are at their clinic. But you know, it's a very reasonable thing to talk about other options right now, but at the same time, finding a doctor that believes in your fertility and has had success with women at your age with your levels, I think would be really important. And take your CoQ10.
I know that has like been a big theme today. So
yeah.
Okay. So the same mom wrote back. So let me just give you the fault to her. I had 3 miscarriages in 1 year. Recently, I've gone through most of the Tushy process. I had an HSG earlier this year. My tubes are clear. Uterus doesn't have any polyps that I'm aware of. Sperm analysis is fine. Low AMH, elevated FSH, and completed the genetic testing and karyotype testing. Both came out normal. I'm also 39. That was the same.
So I mean, that just tells me the egg viability is low, but it doesn't mean that it's a big fat no. You know, with 3 miscarriages, we know the embryo quality is related most likely to the egg quality because the FSH level tells us so. But you just never know when you're going to ovulate the golden egg, right? I mean, it is just so heartbreaking, and it's just really tough on our hearts as well as our uteruses to go through so many miscarriages, but that's just unfortunately part of the human experience for a lot of women, especially women who are 39 who want that, you know, to want to be successful. So if it's not too traumatic for you to keep trying, I would highly recommend trying. And then IVF, not obviously, but you know what I mean, can give you a higher chance of pregnancy and a lower risk of miscarriage if you can test the embryo before you put it in the uterus. So that's something to consider so that you're not going through the miscarriages that you're having. And I'm sorry about those.
I know. And you know, I think it's so important too, especially when doing anything on fertility, that we mentioned that like your mental health is what matters more than anything. So whatever decision you make, have the provider that will kind of do the 360 degrees,
Yeah.
like understand the heart, the brain, and the uterus all at the same time. And find a community, whether it's Social Mama or a partner, but make sure that you have those support people to help you get through this. Okay, so let's see, we have another question, and then oh, perfect. We're going to move into male fertility. This is about male fertility. Way to go. Okay. How much does abnormal morphology play into male factor infertility? Also, does stress play a big role?
Does what? What was
Does
it?
stress play a big role? And she's been trying to get pregnant for years.
Yeah, I mean, it's not just about the morphology, it's also about the other sperm parameters. So if the motility is really good, the count's amazing, the guy is really healthy, the morphology may not be that big of a deal. But if the morphology is, let's say, less than 3%, then fertilization could be an issue. And the test that I use is like my traffic light, green light, red light, is the DNA fragmentation test. So this is an advanced sperm DNA test that can guide me as far as whether I should be really having this couple consider doing IVF sooner than later. It's an easy DIY test, do it yourself. You can order at home, and then your doctor will get a percentage. It'll be a number that tells us what the sperm quality is. Is it good? Is it fair? Is it poor DNA integrity? And then you'll know more about the sperm. But the beautiful thing about sperm is there are a lot of things guys can do to fix the DNA fragmentation or the morphology. So number one, keep your balls cool. I did just say that. Number two, look at all the lifestyle stuff that I've already talked about. Exercising most days of the week, decreasing stress. And then the other thing is check labs. I mean, I actually created Ball's method. B is for background genetics, looking at the DNA fragmentation. A is looking at anatomy, looking at a varicocele. So have him go see a male fertility specialist or a urologist that will check under the hood, palpate his testicles, and see if he has a varicocele. The first L is for lifestyle, second L is for labs, and S is looking at the sex life. So all of those things are really important. There's a strategy that guys can use too to increase and improve sperm morphology if any of those things are potentially an issue.
Yeah, and she wrote back to say that his morphology is 0% normal.
Yeah, I mean, chances are they're still, like, when they do morphology, they're only looking at like a sample of the what million of sperm cells are present, and so it's not like literally zero. I mean, there's probably still a normal shaped sperm, but I think in that case, looking, at hormone levels, varicocele, and the things that I mentioned, genetic testing, I think would be important. And then thinking about IVF as a way to help you get pregnant. If you can't change the things that I just mentioned, then IVF is certainly, especially with ICSI, a way to go.
Okay. Okay, so is there anything else that you've noticed that our husbands can do to increase our chances of fertility? Maybe we already went through that. Is there anything that we missed?
Yeah, there's 3 things.
Okay.
Number 1, shave their chest and their backs and get a G-string, and then call themselves your cabana boy. I mean, literally, we work so hard as women, especially nowadays, to have a family. And I teach the guys here and partners to say, what can I get you? What do you need? What do you want? And you just text your wives that every single day, all day long. And I swear to God, she'll want to like jump your bones.
Yep. No,
she'll love you so much rather than being like, just chill out. If you just relax, it's going to work. I mean, that is freaking annoying.
I think that's trigger for women, to tell them to just chill out and relax about anything.
Yeah.
I think it's just a trigger.
It's like foreplay for a guy to like text you and be like, can I get you anything? And you're just like, oh my God, you are so hot.
Yes, it totally is. And it goes to show you too that just like removing the stress makes the difference. So my brother is an ER physician, and he said that every time that there's a crisis, like, so we're living in Houston, so there was Harvey, there's been COVID, we've had a lot of little global pandemics and crises that have happened in Texas. And he said that every time, like the most amount of people that end up dying and in the hospital are people that are having heart attacks and strokes related to the stress of the situation that's happening. So it goes to show you that, like, when it comes to your health, you just got to try to de-stress, and having a husband that helps you do that, makes it big.
You got to find ways to bring in joy into your life. And for me, it's music, exercise, connections to family and my inner circle, So like whatever it is, you got to find it, you got to work on it, and you got to build your own mind body team. And I loved what you said, heart, uterus. What was it? Your heart, your uterus, your brain.
Brain, heart, and uterus. They're the
Yeah,
three most important organs. Are they all organs? That's what I call them.
I like it. Whatever. It's perfect.
But okay, let's see. So we have about 10 more minutes. So if anybody has any more questions on either, let me make sure I'm not missing any. And then I can pull some more from the app for our last 10 minutes. I think, okay, I got them all there. All right. So miscarriages versus second infertility. I read an article about that. Can you tell me more?
Yeah, secondary infertility is just someone who's already had a baby and is having a hard time having another one. And it can be the same reason that you're having miscarriages can cause secondary infertility, and that's age related. So as we get older, it gets harder to get pregnant and the embryo quality is lower. As we age, the number of chromosomal abnormalities in our embryos go up. And so as time passes, and after a first baby, obviously time has passed. So that's why getting your levels checked, doing your day 3 FSH and AMH level can help. And also other things like you can have growth of fibroids and the sperm quality can decline. So that's why, having abnormal sperm DNA can also increase our risk of miscarriages and also cause secondary infertility. So the treatment approach and the diagnostic tests that we do are pretty similar for women who have both issues. And there are definitely treatments that can help you. And so, like I always said, seeing a doctor that can guide you through the different tests, you have to ask them, what do these tests mean for me? What are my chances of pregnancy for the different treatments that you're recommending for me? And what do you think I should do based on the family size goals that I have? And make sure that you get a prescription for success. And if it's been 6 months or a year since you've had your levels checked, do it again. Because these levels change over time, and you don't want to make an assumption that that first snapshot was actually perfectly accurate about you. So for example, the FSH levels can kind of go like this. So potentially maybe when you check them the first time, they were low and reassured your doctor that everything was quote unquote normal and you had nothing to worry about. So depending on your age, it may not be a bad idea if you're still not pregnant and aren't ready to move on to any type of treatment to get your levels checked again and see how they're trending over time. Maybe you'll learn something more about what's going on with your body.
Well, and I mean, being your own advocate is so important, right? So I love your idea of having that fertility binder and starting as early as now, even if you haven't even tried to get pregnant yet. I think it's such a good idea. Right. And then, okay, so here's another question. So how do immune diseases affect fertility? I have lupus. Do I have any lower chances of having a baby when I start trying?
Yeah, I mean, with lupus, it's an autoimmune condition and it can affect other organs in your body. If you have an autoimmune condition, you might be at risk for other autoimmune conditions as well. Women with lupus might have taken a medication called, I think it's methotrexate. That might be one of them. I might be wrong, but I'm pretty sure women with lupus can take that medication as a treatment, and that can affect the quality of our eggs over time. And so women with lupus, before they start treatment, sometimes because of the treatment regimen, doing egg freezing ahead of time, or if you're partnered, embryo freezing, even if you're not partnered and want to use donor sperm, of course you can without being partnered, but doing a fertility preservation procedure could be helpful. Women who have positive lupus anticoagulant and other issues like anti-Smith, anti-Rho, double-stranded DNA that's positive are at higher risk of having pregnancy complications. So it's super important to talk with a high-risk OBGYN ahead of pregnancy so they can talk to you exactly how you will be monitored during your pregnancy, and your OBGYN has that plan so that once you're pregnant, they know exactly what to do for you. You might be on steroids, you might be on Lovenox as a blood thinner. Those medications can be managed during pregnancy, and sometimes being on a blood thinner like Lovenox in pregnancy might be required for you to stay pregnant and have a healthy live birth.
So I think, thank you to the person that just said, thank you so much for having this webinar and providing us with this wonderful opportunity. Dr. Aimee, really appreciate this. You're welcome. But everyone else, hang on, we have 5 more minutes. Okay. So when is too old to have a baby? That's an easy one.
I mean, it's not, I mean, my thing is if you want a baby, you can have a baby. I mean, like George Clooney, everyone like swooned when he had twins and he was over 50. And for some reason, when a woman's 50, they're like, oh my God, she's so old. And I'm like, no, she's freaking awesome. Because obviously like she feels young and she feels strong. You're not going to have a baby at 50 if you're feeling like an old lady. You're having a baby at 50 because you're like on fire and you're ready to like crush it and like have kids, you know?
Yeah.
So
Literally all the people I know that are 50 that are baby, these women are like swoon. Like I want to swoon them. They're the coolest people.
yeah, and they look like J-Lo. I mean, they're like fit, they're eating right, they like care so much about their health and wellness because they know they want to live forever for their kids.
Yeah.
So obviously, you know, if you're over a certain age and you have, you know, multiple medical problems, high blood pressure, obesity, it's not going to be for you if you're over 50, right? I mean, that's just the reality. And there are other ways to have babies, like through using a gestational carrier. And my patients who are over the age of 45, 99.9% of them will use an egg donor or embryo donor unless they froze eggs or embryos at a younger age. And even for women between 40 and 45, the majority also use an egg donor just because it's so hard to get pregnant over 40. But don't lose hope. Don't give up. There's still a chance, but talk to your doctor ahead of time before you start that journey.
Well, so then, I mean, based on what you just said, to me, what I just heard was if you think that there's any chance you're going to want to have a baby post 40, freezing your eggs if you want them to be your own genetic children, is that how we say it? It would be smart. It sounds like that's just 101. So
yeah, I want my patients to be their own egg donors. You know, donate eggs to yourself, you know, freeze them when you're 25 so you can donate them to yourself when you're 40, or for husband number 2 when you're 45.
I told you these 50-year women, they're the coolest ones that do it. So a lot of them are probably on their second at that point. Okay, so birth control. When if I'd like to get pregnant?
So there's no such thing as needing a cleanse or anything like that. I mean, once you take your last birth control pill, it is out of your system and you can start getting pregnant right away. But I recommend doing, you know, a preconception visit with your doctor, checking hormone levels and make sure you're not missing anything like a thyroid abnormality, for example. But for the most part, you don't need to wait. You know, stop your birth control pill and start getting pregnant. You know, you can use an ovulation predictor kit, and typically you'll ovulate if you have a 28-day cycle about 14 days later. However, birth control pills can trick people. They can make you think that you're fertile because you have regular periods. And so that's why I always tell women to get their AMH levels checked so that you're not being fooled into thinking that you're fertile because you're having fake periods on the birth control pills. Same thing with the IUD. If you have an IUD placed and you don't have periods, especially after 5 years, once you're ready to remove that IUD, you don't want that to be the time when you find out that you've run out of your healthy eggs. So that's why I think checking your levels when you're on birth control pills or have an IUD is really important.
Yeah, it's and that definitely happens to a lot of women because I've seen that posted about several times just in the last month, actually. I feel like that's quite common. So, well, I think we have no more questions and we're at the end of the hour anyway. So for anybody who's watching us, I just put in the comments again, Dr. Aimee's website and then also SocialMama's website. So Dr. Aimee is an incredible fertility doctor, women's health specialist who can help you on your journey of fertility. You can find her, watch her YouTube. Not only is she hilarious, it's informative. I highly, highly, highly recommend it. And her Instagram stories are great too. And then for anyone who's not on SocialMama, we'd love for you to join us. We are available for free on the App Store or Google Play. It is the place to find the mom friends that you need and the experts you can trust for advice, like Dr. Aimee, who lives in our app to respond to questions. So I think that's it. We're going to let you go back to IVFing and egg and everything you do 24/7.
I'm going to be doing it. Okay. Thanks so much. Thanks for all you do, man. See you later. Bye. Thanks for everything. Bye-bye.